Now to the Ebola epidemic. The World Health Organization is calling it, quote, an unparalleled crisis in modern times. The WHO says it will cost around $1 billion to properly fight this virus. But as CCTV's Jim Spellman tells us, that fight is getting some much-needed help now from the United States.
As the death toll from the Ebola outbreak rises to nearly 2,500, a plan for help from the United States.
Faced with this outbreak, the world is looking to us, the United States, and it's a responsibility that we embrace. We're prepared to take leadership on this to provide the kinds of capabilities that only America has.
The U.S. will send up to 3,000 troops to the region. To direct operations, the U.S. will build a new command and control center in Monrovia, Liberia, led by a U.S. Army general. The plan also calls for the construction of 17 Ebola treatment centers in the region, capable of treating 1,700 patients. U.S. personnel will train 500 healthcare workers a week. Along with the United Nations, they will distribute some 400,000 home protection kits in Liberia. 65 U.S. medical personnel will also staff a special treatment center for healthcare workers. President Obama says there's no time to waste.
It's spiraling out of control. It is getting worse. It's spreading faster and exponentially. Today, thousands of people in West Africa are infected. That number could rapidly grow to tens of thousands. And if the outbreak is not stopped now, we could be looking at hundreds of thousands of people infected, with profound political and economic and security implications for all of us.
The goal of the U.S. plan: contain the current outbreak and build infrastructure to limit future ones. Those 3,000 U.S. troops are not expected to provide direct patient care, but instead will focus on planning, training, and logistics. Jim Spellman, CCTV, Washington.